Hi, everyone. Welcome to the Kind Health Group YouTube and podcast. Today, we have a very special guest, David Bruemmer. David is the CEO of W8less. Mr. Bruemmer is leading large-scale efforts to deliver micro-positioning, a key enabler for the Internet of Moving Things. Previously, Mr. Bruemmer co-founded 5D Robotics, which he grew for 8 years into an industry leader in robotics and autonomy before it was acquired in 2018. Mr. Bruemmer has worked on large-scale robotic programs for the Army and Navy and the Department of Energy, the Department of Transportation, and DARPA. Mr. Bruemmer has authored over 60 peer-reviewed publications, has been awarded 20 patents in robotics and positioning, and he won the South by Southwest pitch competition sponsored by Caterpillar and is a recipient of the R&D 100 award. Welcome, David. It is an honor and a privilege to have you here today, and I'm so happy you made the time for us.
Hey, thanks. This is my privilege.
Welcome, David.
And Annie is with us again. Hi, Annie.
Hi.
So we have a lot of things we want to cover, and so let's get started. Annie, you want to fire away?
I guess I'm just going to start at the beginning, and I know you can speak at length about this, but why doesn't the current model work, in your opinion, or a model?
For COVID-19.
For COVID-19, for tracking.
Yeah, well, one of the big things we learned in artificial intelligence is that there is no one right model, and that intelligence really needs to be context sensitive. In this case, I think there is no model that's going to be right for downtown New York and Santa Barbara, right? Because you have so many factors that are fundamentally different. So I think there's a desire on the part of very well-intentioned officials to have a simple, straightforward course of action that people can understand, and that can be sort of handed out in a universal fashion. But the problem is that there is no model which can be applied uniformly. There shouldn't be, in other words. So even seemingly small differences, like whether or not people live in apartment buildings, the issues associated with public transportation versus traveling in cars, these things are going to end up being potentially very significant. And it's incredibly difficult to create a model, especially a single model, that will apply across the board.
I guess my question is, how can AI help currently? What can we be doing better?
Yeah, well, another thing we learned in robotics is that update rate is very important. And all I mean by that is the ability to be responsive is very, very important. Like, imagine, for those of you who play video games, if you see a big network lag, your soccer player or your character, gets delayed, and essentially things fall apart. So in robotics, update rate is really, really important. And in fact, it's a critical attribute of intelligence. And so what's happening right now is that our policymakers have a very, very, very slow update rate. And this isn't their fault necessarily, it's just that it's very hard to get information. So I'm a big believer in a feedback-driven approach. And we want that feedback to be in essentially as close to what we call real time as possible. One example of how to do that is with contact tracing. Because with contact tracing, we can update the database of who's been affected immediately.
Can you maybe, just for our listeners that don't know all the terminology, explain what contact tracing is?
Yeah, well, it's actually, as you know, more of a medical term than it is a robotics term. You might be the one to explain it better.
I know, but I like hearing you explain it.
Oh, well, that's a poor judgment on your part. But contact tracing is really just the idea that if you can sort of sleuth out the communication of this disease, you can take action very quickly. And one of the examples is, the sooner you know that someone's been affected, the sooner you can quarantine them. And if you know that they've already impacted their family and some of their workers, you may choose to also quarantine the family and workers as well. So this is considered a much more, feedback-driven approach, in that it's based on data, and ideally would be able to update this very quickly. And so this isn't just a theoretical concept. This was used in Singapore. This was used in towards the end of the time period in China. It's also been used in Taiwan, and the results, as I understand it, have been actually quite compelling. So one of the biggest differences we see in how the data has differed from country to country is in this question of whether there's been feedback. So in other words, I think in the United States, because we couldn't do testing, at least we couldn't do as much as we would have liked, and because we didn't do contact tracing effectively, we really had to rely on pronouncements that were sort of given out uniformly across the board. And from a robotics perspective, there was no sensor data. Like if a robot requires sensor data to act intelligently, we were like a robot that had no sensor data. So no matter how intelligent our brains were, it couldn't really be translated to action effectively. Other countries that were able to institute contact tracing were able to sort of pounce very quickly on the hotspots and address those hotspots instead of telling the entire country to essentially hunker down.
So contact tracing and data are critical elements in responding to a public health emergency in epidemiology. And this is, you and I have talked about this, and this is what I've studied as well. And I agree. One of the big shortcomings in the US is that we have an incredible, incredible to believe lack of data considering the sophistication of our country. But I think it also speaks to the fragmentation of our healthcare system, and our healthcare system is that, although people like to think it's just state of the art, best in the world, it's best for extreme conditions and chronic conditions and experimental care in cancer and heart disease maybe. But in the simplest of worlds, we are like in the Stone Age when it comes to gathering data for an event such as this. So, and I think people don't. I mean, I've known that for a long time. I think you know that.
So can I ask then, how is Singapore and Taiwan? How are they collecting data so much faster? What are they doing that we're not doing, and how do we get to do the same thing?
Yeah, I think there's sort of there's a regulatory aspect, there's an AI aspect, there's a privacy dimension to this, and then there's also a mindset issue, right? And of those, I would say the mindset issue is the most important. And there's like everyone from the leaders to the population has a fundamentally different mindset. And one of the things that hasn't been talked about is that the US mindset is, it is for something like this, it's not helping us. So let me explain what I mean by that, right? I think in the interest of making science as scientific as possible, we for many, many years have focused on large population studies with the idea that unless something has been proven with a blind test done across large swaths of the population, it isn't really science. And so essentially from that perspective, unfortunately, even if a doctor comes up with a brilliant strategy, or even if there's this desire to have a fast response, or what I'm calling a fast update rate, things still have to go through this long, painful, bureaucratic process, which I'm not saying is right or wrong. It's just the truth here. So our ability to adapt quickly has been curtailed. And I think the issue is that people want a risk-free path forward in our country. So you have this mindset that unless we can be sure that our strategy is right, then we can't move forward. And I think other countries, Sweden is a great example, have essentially said, well, to be honest, we don't know what the right strategy is, but we're going to adapt as quickly as we can. We're going to take on some risk. We might be wrong. And if we are, we'll change, right? We'll change course and go on a different path. Sweden has been criticized, and I'm not here to say whether Sweden's right or wrong because we don't know yet. But the issue is they've sort of said, hey, in this kind of dynamic environment with this much uncertainty, using a model-based approach where we essentially plan analytically and then stick to the plan could be a disastrous course of action because it prevents our ability to adapt. And that's really one of my biggest fears. Now, back to the AI strategy, what is really interesting about the convergence of what we sometimes call IoT, stands for Internet of Things, artificial intelligence, and this medical need that we have to do contact tracing is what I call micro-positioning. And what micro-positioning does is it allows us to have so much more accuracy and reliability, and that makes the problem of sleuthing out who has the disease and who's come in contact with whom much, much, much better, much more accurate, much more meaningful. So in theory, the very same thing that we need to make autonomous driving more reliable, the same thing we need to make safety in cars more reliable, could be, in fact, a huge boon for contact tracing and ultimately allow us to move much more effectively to curtail the virus. One of the things that Georgina and I have talked about quite a bit is that this isn't just a question of the next couple of weeks. This is more a question of how do we deal with viruses for many, many years to come. And you know, what this has taught us, which we may look back on this and see that there are some good things to our current experience, is that if we can take this as a lesson learned and build a system which is more responsive, which is more data driven, and which is more adaptable, then I think, you know, again, we'll look back on this and say this was sort of a hallmark moment, not only for the medical community, but for sort of science in general.
So I want to touch on one of your earlier points about mindset in the United States. And I think that's something really important in this conversation, because in countries like Singapore, there's a lot of government oversight, and you know, they sacrifice a lot of personal freedom because they have a centralized healthcare system. They have all this data that is collected on a national level, and the government is providing all this data to a national database, so the data is readily available and, you know, able to be aggregated quickly, and they can respond in a more agile way. Whereas we are light years away from that in healthcare in America. And so, and then by the same token, there's a, you know, general sense as Americans that we don't want to have the government or any organization having so much information in about our private movements. And so there's that give and take that I think in an American mindset, it would be very hard for us to adopt, you know, a similar kind of approach that you see in countries like Singapore, who have been very successful because they have had those systems already in place. And it's just, I think you know, as Americans, we're very fixated on privacy and our personal liberties and civil liberties and freedoms and freedom of movement. And so that's why this has made it this particular situation is very hard for us to swallow. How do you see that changing, or can it?
Yes, it's a great question. It may in fact be the most relevant question to enacting a strategy like the one that the European Union is trying to do right now. So the European Union has taken this idea and it is trying to enact it right now with Bluetooth, using cell phones, and not surprisingly, a lot of Europeans are very concerned. I want to make a few points, right? Like any technology, it can be used for good or for bad. And a lot of it does come down to the fundamental architecture. I think a lot of people in our country don't understand they've already surrendered their civil liberties, right? With or without contact tracing, corporations are not only tracking them and selling their data, which I think almost everyone knows, but they're really influencing us. To some extent, they're driving us like robots. They're telling us literally when to turn left and turn right. They're telling us what books to read, who to date, right? We're under the influence of centralized control right now. And I think we're at a crossroads where not only for contact tracing, but for many, many different applications, things like connected vehicles, autonomous driving, but even more basic things like how you get stuff delivered to you. On one path, we're going to increase the influence of centralized control. And in this case, I mean, you know, Amazon servers, right? Google servers, Apple servers. It's no surprise, you know, you get it, right? These are the locus of power telling you what to do, and they absolutely know where you are already.
I find it so, I'm sorry to interrupt for one very quick second though. I find it so interesting that people are so willing to give up that information and accept that information or accept that that's happening. But when it comes to their health, it's a totally different ballgame and health data.
It is literally insane. Like I'm not exaggerating when I say it's one of the strangest things about our culture. Just today, Twitter told me on my phone that I was officially losing control of my data. And there was no like opt-out button. I mean, it was crazy. It was like, how do I say no? And the answer was, you cannot. So it was like, we're officially legally telling you, you now no longer have any control over your Twitter data. So that's very significant. Now, my concept of how we do micro-positioning and in general, just this bigger issue of how we control data is that I want us to move more towards a decentralized approach. And I would argue that although to most people, they're going to say, oh, David, the stuff you're talking about is very technical. I don't understand what you mean. It's literally the most basic thing in the universe. In one case, a central locus of power is going to control you and tell you what to do and influence you. In the other case, you own and control your data and everything is distributed, right? To use a very, very basic analogy, it's sort of like the Empire and the rebels in Star Wars, right? We're either going to become more and more sort of like controlled, or we're going to have more and more sort of individual volition. And
please tell me we're the rebels.
I want to be the rebels, but that's not the trajectory that we're on, right? So to be very clear, we have a myth in our country that we have all these fierce individuals. That may have been true, 150 years ago, but it's not true now. I mean, it's not. So we have exactly the opposite. What I would want out of this is to be able to build a swarm-based approach where no single entity, whether it's Google, whether it's Apple, whether it's the United States government, controls your data or calculates it. In other words, to be specific, the network shouldn't calculate your position. You, meaning your device, should calculate your position. And what you do with that data should be entirely up to you. So in terms of contact tracing, your phone could look up in the database and understand who you're close to, not based on their name or personal information, but based on whether they're in the green or red bucket. Do you see what I mean? So it's not about—
green or red bucket, meaning like this person's been infected, this person has not. Okay.
Exactly, yeah. So this doesn't have to include any loss of personal data. It doesn't have to include any loss of privacy. I mean, one way to look at it is to say, like, right now, I'm being told to shelter in place, one of the greatest losses of individual freedoms in history, right? So actually, doing contact tracing would be a way to return your freedoms to you, right? Not in any way a method of taking them from you.
So that's a great theory, and I think it's amazing, and I would love for that to happen. How do we make it a reality?
I think, honestly, people have to believe that it's possible, right? So if you talk to the people who invented GPS, very few people understood the impact that GPS would have on humanity, right? And amazingly, if you talk to those inventors, like they went around and told everyone, and everyone just ignored them. They literally couldn't understand. Like the conversation would say, I don't understand. I've been using maps for a long time. Are you telling me I can't go to the store and get a map? Like, why would I need global positioning? It's a crazy, crazy idea. And they just didn't get it, right? In the end, the only use case which justified GPS was control of intercontinental ballistic missiles, right? So we're at another crossroads where I think people don't understand how much swarm-based micropositioning would affect their life. Their Uber driver could get to them much faster. Things could be coordinated so much better. Traffic could be, traffic congestion could essentially be eliminated or very close to it because of the connected vehicle strategy that the Department of Transportation has actually validated. And of course, contact tracing would be a fantastic way to respond in real time to the spread of the virus. But none of those things are possible if we don't take action. And we absolutely shouldn't count on large corporations to just do this for us, which is what Apple and Google want to do right now. It needs to be something which is done certainly by the public sector, absolutely, but also with the right kind of guidance, funding, and oversight from our public servants who really do, I think, have fundamentally our interests at heart. It's just that to some extent, we need to make sure that the right mindset and the right controls are in place before we proceed. So I think we have to be careful. I don't think we should assume that Apple and Google are going to sort of enact this in a way that is in the best interest of the public. So I think, much is being done right now in the European Union. We have to look at what's best from a technological perspective. We also have to look at what's best from, the perspective of public health. And then we need to look at privacy. So in my mind, those three things have to sort of counterbalance one another for us to end up with the optimal solution.
Well, and what happens to access? I mean, if people don't have access to technology or can't afford the cell phone or whatever it is that's tracking this, then the theory is kind of...
Well, I'm glad you asked. No, I'm glad you asked, because like in my model, the government would absolutely say, look, for the benefit of this, we will spend the $5 and give this device to everyone. It doesn't have to be in a cell phone. So like we have a version of this right now that includes U-Blox GPS on one side with a battery. It's got the ultra wideband, the Bluetooth, essentially all the different technical elements that you need in a tiny, tiny little package. There's no reason why that couldn't be given to people who don't have cell phones. And I'm not suggesting that we would be the only ones making this, right? I'm just saying, like any standard, like USB or a floppy drive from the ages past, there would be essentially an IEEE standard or an SAE standard, whatever kind of standard you want to choose. Those devices could be made by multiple companies, but yeah, absolutely, those could be provided for by the government. And if anyone says, oh, well, how would you guarantee such a thing? That's ridiculous. Like what we do it with license plates. Like people, it'd be like someone complaining like, well, there's no way we could get everyone to put a license plate on their car. That's crazy. It was like, no, we do. We absolutely do. We tell everyone they have to have a license plate on their car. So could you do that in terms of this health crisis? Absolutely.
Sorry, David. I agree. I think the cell phone is actually the best vehicle because it is the most ubiquitous device on the planet, even in the most, austere situations of poverty. You still shockingly do see people who have cell phones in those situations in the favelas in Brazil and even in remote parts of Africa. So I think from an access standpoint, the cell phone really is the very best tool because it is so ubiquitous. But getting back to an earlier statement you made about not having this be driven by large corporations like Apple and Google and putting it in the hands of the public sector, my question is, do you feel like you can put faith in the public sector right now from a top-down government approach to do this right when, we're screwing up just the most basic things? And I'm not saying this in a partisan way. I'm just saying in general, this is like, kind of some of the basic elements are very hard to manage. So I think the idea of relying on the government to make a decision, and they're going to end up farming it out to another big corporation anyway. And so, how do you see that really playing out in reality?
Yeah, and this is a great question. It would be the greatest hubris for me to try to say, hey, I know what to do, because the question you're asking is basically what kind of government should we have? Right? It's like the most basic question. Here's what I would say at the risk of sort of walking into the exact trap I just identified.
Is this a President Bruemmer campaign?
Well, I don't want the responsibility for this, but I do think that we need a dynamic tension, as I said before, between large corporations and the public sector. I also would add to that the importance of individual choice. I do really believe that those things all have to kind of be in a balance, right? I've worked with many public servants, especially in the military and the Department of Transportation, the Department of Energy, who were just brilliant. They were well-intentioned. They wanted to do the right thing. And I think they were geniuses in some cases. But regulatory issues often got in the way. And that, for innovation, is just one of the hardest things, right? We can't allow regulators to hold things up forever. And in the end, that comes down to discernment, right? That's what's tricky is, so many good ideas don't see the light of day because of regulatory issues associated with getting them through. And I would hate to see that happen.
Well, it's not even just regulatory issues. It's just the plain bureaucracy itself. I mean, beyond just regulatory, anyhow, go ahead. Sorry.
Yeah. You know me, Georgina, I'm no lover of bureaucracy, right? So I think the question that you're posing is a good one. Again, I'm going to fall back to like the most basic lesson I've learned in 20 years of deploying robots in crazy environments, which is feedback trumps everything. In fact, I'll say it in a kind of strange way, if you'll allow me, which is to say it's way more important to update than it is to be right. So even if you start out with a policy which is wrong, as long as you use data to improve it quickly over time, you're going to end up in a good place. So I think the thing we don't want to do is make an ideological decision and then stick to it, even when it doesn't work, which is exactly what we've been doing, right? We need to instead say, let's develop metrics. Let's have metrics that look at privacy. Let's have metrics that look at medical effectiveness. Let's have metrics that look at the dollars spent and the benefit gained. And then let's apply those on a monthly basis to the process in hopes that that can guide us well.
So what would you like to see happen in like immediate next steps? Like what are some tangible ideas that we can implement, or what is the next step or the next few steps that you think are achievable in the United States in the next few days, weeks, months, we're talking realistically?
Yeah, well, I've been talking with the leadership of a lot of our biggest companies that we're working with. I won't use their names right now, but some of the largest corporations that really like this idea of using swarm intelligence to do more effective contact tracing. We're getting a tremendously good response. There was discussion today about developing a test bed. So on a technical level, I think we can develop test beds and actually take this to task. Like we can
What's a test bed for everybody?
A test bed would basically be like an area in a city where we have the technology working, and we look at how quickly essentially the authorities responsible for tracking the disease can respond using the micro-positioning. So that's sort of like a pretty obvious example, right? Is you test it, like you make it work in the real world, right? The second issue, though, I think is more of a mindset issue. And what I would love to see, and I hope everyone agrees with me on this, I don't think it's that original, is to say, like, let's remove the problem solving from the realm of ideology and partisan politics, like, which is not helping anything. There's so much discussion without problem solving, and like I'm amazed, right? I just like, well, what do you suggest? Like, what are the actionable steps that we can take? And I think that's what we need to be focused on. There are some people at the White House, like I know Lynn Parker is a colleague who I worked with on swarm technology going back many, many years. She's advising, Donald Trump directly, and I think people like that are trying to problem solve. And my heart goes out to them, like they're doing the best they possibly can. But I think in general, like one example of something that can be done by medical professionals is to say like, hey, let's update our models much, much faster. And let's make our models sort of tailored around the specific geographic area. What in swarm terms we would say like your nearest neighbors. Like we need a more local distributed model when we make decisions. I think that's imperative. And if you look at the data right now, I don't see how anyone can argue against that, because the kind of spread that we're seeing in New York is very different than what we're seeing where I am here in Santa Barbara. So I think, when you look at the data, it's pretty obvious that we need to be taking, pains to update our models and take into account like what's actually happening here on the ground. Well,
so getting back to, again, I just keep getting back to these fundamentals about the data. I mean, yes, I agree. All of what you're saying makes perfect sense, but we don't even have the basic data. We can't even get the tests. We can't even get the testing out there. So without the data, we're completely flying blind. And so I think Yeah, it makes me sad.
Yeah, I think it is kind of a sad moment for science in the sense that here in the country, um, I don't think we have the data we need. So I agree with you, right? On a sort of I don't know how to say it. I wonder to what extent the kind of anecdotal empiricism, if I can use that term, because I hesitate to even use the word science, but the kind of observational empiricism that was used historically in cases of pandemics is really, really interesting. So in other words, there were many cases throughout time where a few individuals did very small but effective studies and figured stuff out on the fly, right? And I guess I'm curious to know how those efforts are going to proceed, or if they will proceed at all. In other words, like my worry is that in our desire to have like what I'll call big science solve our problem in the optimal way, will we sit on our haunches and sort of not take action at a local level to do everything that we can? I would hope that smart people everywhere, whether they're scientists or not, can use common sense, can use powers of observation to figure out what works in their communities. Because I guess that's the best we can do, right?
Exactly. Yeah. And I think the reliance on big science and data and you know, the rigorous scientific method that a lot of drugs and medical devices go through, there is a reason for it. I know in the beginning, you know, one of your comments was that it's too cumbersome, but health and safety and efficacy first, it's safety first. And it sounds silly, but like, to put something out there on the market or recommend something that is going to cause a lot of potential harm. And, you know, we have to keep in mind, this is everything that gets out there now gets spread like wildfire. And and if it's not properly vetted, then we are going to have issues with safety, primarily, you know, to include deaths. And then, you know, the next thing is efficacy. So there is a method to the madness with the scientific method and rigorous scientific investigation. So I think that's important to keep in mind, and that, you know, it's part of the process, even though it's frustrating from the outside. You can look at hydroxychloroquine as an example. I mean, has now been shown to be ineffective, and you know, we were touting it with tiny anecdotal evidence and observational studies 3 or 4 weeks ago. So I think we just need to keep that in mind.
Absolutely. I mean, you know, I think one of the phrases that keeps coming to my mind, you know, was so important for the kind of robotics that we did, especially out in the field, right? Like where, you know, you're sticking a robot in a tunnel and you don't know if you're ever going to see it again, and you don't have time to make all the right changes, because once you're there, you realize like, oh my God, this isn't going to be like we thought. Like this is a totally different situation. And so I remember like literally sitting there typing away in the laptop, like making changes and thinking this goes against everything that I've been taught to do in terms of software engineering. You know what I mean? It should have testers, it should be vetted. You know, the last thing they should be doing is making changes at the last minute. But on the other hand, I'm like, well, I know that the existing system is going to fail. You know what I mean? Like I know that. So even though the things I'm doing right now are questionable, I'm going to do them anyway. And ultimately, we have to give up on optimality. I think the reality is that sometimes perfect, you know, is the enemy of good enough. Now, in regard to medical testing, I'm in no position to make pronouncements about that whatsoever. You know, that's not my intention at all. I think everyone involved in the process and in the bureaucracy associated with medicine, I trust, is doing everything they possibly can to be expeditious. I hear great things, and, you know, my heart goes out to all those people putting in long hours to do that. So I'm not in any way saying, I hope this is obvious, that you know, the medical industry just needs to cut corners and be faster, right? But I do think that when it comes to models, when we look at sort of how to respond, I think we can end up in sort of an analysis paralysis mode. And I think, you know, really the question isn't, should we cut corners? Of course not. Everyone would want the science to be as rigorous as possible. But in my mind, really the question is, what do you do when you're faced with a whole ton of uncertainty? One of my favorite quotes is by General Patton, someone who did have to deal with a lot of uncertainty. And, he said, plans go out the window the moment the first shot is fired. And actually, even though this isn't sort of part of the quote, I would also add that, anecdotally, when he would talk to people about his sort of distaste for planning-centric approaches, or what, I would call model-centric approaches, he would say, guys, put all that energy you want to put into models into preparation. In other words, spending a week of planning is no substitute for not having spent years preparing. And man, like that to me is the most direct message that I would like to communicate, which is, it's not wrong to model, it's not wrong to plan, but if you have to choose between, what I would call static models and a priori plans on one hand versus preparation, prepare.
Yeah, and I think that's the biggest takeaway. I'm sorry. I think that's definitely the biggest takeaway is that, this will give us an opportunity to dramatically increase our level of preparedness for the next time. And we know there will be a next time, whether it's COVID-19 in, several more months, just coming back, that, we can attack it differently. So I agree with everything you're saying. Let's try to end on a hopeful note. Whatever you think that might be.
I think one of the important takeaways was, a lot of people are working really hard, and let's look at it in a different light, right? The old way wasn't working. Let's try to think of a new way to problem solve for the future.
Yeah, I mean, I would love to work hand in hand with you guys to put together a workshop where we used a multidisciplinary approach to think and brainstorm, right? To be clear, don't think that I can solve this problem. Of course not. And I don't think any one person can. I don't even think any one discipline can. I think one of the challenges here is that there's no way that we should be moving forward without influence from different perspectives. So AI, public health, medicine, epidemiology, economics, all these things sort of have to influence our approach. And we all need to have a degree of humility about, sort of like what we don't know, right? And as we've all said in this conversation, there's a lot that we don't know. On a very positive note, I couldn't be more optimistic about the benefits of contact tracing. I think it is a fantastic way to address this problem. And if we do it right, it could influence not only how we respond to diseases, but it could influence things like traffic congestion, greenhouse gas emissions, and transportation in general. So that to me is incredibly positive, right? This could sort of be the impetus that causes us to make some big changes. So that's very exciting. And my hat's, definitely off to both of you for the local work that you're doing, constantly sort of talking to the media, being on TV, communicating positive message to folks, giving a lot of sort of very tailored individual input. I think that's so fantastic. I personally benefit. I call you both up and bother you on a regular basis to get sort of the feedback that I need for my personal health. So I think all of that is fantastic. And I think if everyone had access to the kind of healthcare that you guys provide, we'd be a lot better off.
Thank you so much. Thank you, David. We really appreciate you taking time to be with us today. This was an incredible discussion. I can't wait to get it out there to the public. And again, I appreciate you and your time.
Thank you so much.
Thanks, guys.